What is the most common symptom of myocardial infarction? Chest pain. What is the best position after myocardial infarction? Supine with head of bed elevated 45 degrees to 90 degrees. What is the correct landmark for obtaining an apical pulse? Left fifth intercostal space, mid-clavicular line. Which blood test is most indicative of myocardial infarction? CKMB. Which blood test is most sensitive for myocardial infarction? Troponin. What medication is ordered to supplement Lasix? Potassium. What is the quickest, most widely used tool to diagnose myocardial infarction? Electrocardiogram. What is the first intervention for a patient experiencing an MI? Administer oxygen. Which class of drugs protects the heart muscles by decreasing the effects of the sympathetic nervous system? Beta-adrenergic blockers. Which class of drugs reduces the workload of the heart by decreasing the heart rate? Calcium channel blockers. What is the most common complication of a myocardial infarction? Arrhythmias. What are the classic signs of right-sided heart failure? Edema and jugular vein distension. What position should we place the head of a client to accurately assess jugular vein distension? Head of bed raised 30 degrees. What should we always check before administering digoxin? Apical pulse. What are the most common signs of digoxin toxicity? Halo around lights, nausea and vomiting. What is the classic sign of left-sided heart failure? Crackles or rales in the lungs. What class of drugs increases ventricular contractility? Inotropic drugs. What is the most common cause of an abdominal aortic aneurysm? Atherosclerosis. What is the classic sign for an abdominal aortic aneurysm? Abdominal pain. What is the definitive test to diagnose abdominal aortic aneurysm? Arteriogram. What is the greatest concern for a client with abdominal aortic aneurysm? Rupture of the aneurysm. What sounds are heard upon auscultation of abdominal aortic aneurysm? Bruit sounds. Clients with what hereditary disease are more likely to develop an aneurysm? Marfan syndrome. What is the definitive treatment for ruptured aneurysm? Surgery. What is the predominant cause of angina? Inadequate oxygen supply to the heart muscle. What is the primary treatment goal for angina? Reversal of ischemia. What is the most common cause for cardiogenic shock? Acute myocardial infarction. What is the earliest sign of decrease in cerebral blood flow? Altered level of consciousness. What is the initial treatment for cardiogenic shock? Increase myocardial oxygen supply. Which drug is most common for treatment of cardiogenic shock? Dopamine. What hormone raises arterial pressure by vasoconstriction and promotes venous return? Angiotensin II. What is the most common symptom of hypertension? Occipital headache. What treatment is used to eliminate varicose veins? Ligation and stripping. What sign is diagnostic of deep vein thrombosis? Hohmann's sign. What is the best position for a client with acute pulmonary edema? High Fowler's position. What is the classic sign of acute pulmonary edema? Pink frothy sputum. Left-sided heart failure is usually a result of damage to what chamber of the heart? Left ventricle.